Now, can you explain why PRSB is so important and unique?
The Professional Record Standards body is really important because what all the doctors in the United Kingdom want is for patients to have an electronic patient record. We want to move on from pens and paper. It can get lost, mistakes can happen, so that record follows someone each time they're admitted to hospital. It's instantly available, and what your GP knows, your hospital knows. That's the really big advantage of it.
So why is it so unique?
Electronic patient records are used throughout the world, and indeed in the United Kingdom general practitioners have been using them for probably 30 years. What's really unique about this is that we want a record that can be used throughout the whole of the National Health Service, and it can be transferred between, if you're moved between hospitals, it can be transferred between your GP and your hospital doctor so that the right hand knows what the left hand's doing. If you've got an allergy to a drug, then everybody who treats you knows about that allergy, and having a single common standard and a single common set of information is what's really unique.
So what do you see as being the most challenging aspects going forward over the next few years?
I think the big challenge to the NHS is it is a huge organisation. NHS in England covering perhaps 60 million people. We have 4 countries in the United Kingdom. So the adoption of electronic patient records and electronic prescribing into general practice in a way was easier. Smaller organisations dealing with perhaps 10,000 people. Big challenge is to get this right for a large number, and there's been some spectacular failures. So we have to make sure this time we absolutely get it right.
And how do you think we're going to get the public on board with this?
The best way to get the public on board is to be absolutely honest with them and speak in plain English. So the advantages of having electronic records is that they get better care, less chance of mistakes, less chance of drug errors, less chance of surgery on the wrong part of the body or the wrong person. So we just need to explain the benefits. They will be anxious, of course, about the risks. Will my information be left on the back seat of somebody's car? And we need to absolutely reassure them about how safe it will be kept, and the fact that it will not be released to companies like insurance companies that would affect their premiums or their ability to get a mortgage. We really need to make sure we do tell the public how safe this is.